Now we are moving on to our very last section, panel discussion set, wherein we are covering a topic on digital mental health, innovations, challenges, and the path forward. Here we talk about explore the advancement in digital mental health tools, including teletherapy, mental health apps, and the virtual support communities. Discuss the challenges and ethical consideration associated with using digital technologies to address mental health issues, including privacy concerns and potential bias in algorithm. Now, I would like to introduce Mr. Bhupendra Kumar Rana, founding CEO, Quality and Acceleration Institute, QAI, our moderator. Welcome, sir.
Thank you.
Along with him, I would also like to invite Ms. Priyanka Sachdeva, founder, Core and Pure. Welcome, ma'am. Ms. Shivi Sabrawal, co-founder and director, Wellin.
Thank you.
Welcome, ma'am. And Dr. Sushil Mehra, medical informatics, AIMS. Welcome, sir.
Yeah, thanks for inviting me.
Mr. Bhupendra, sir.
Thank you, Alicia. Thank you very much for kind introduction. Welcome, my panelists, eminent panelists, in fact, and all the participants to this wonderful webinar on digital mental health. I think I was taking some time to understand what does it mean, actually. Are we going to manage mental things in terms of, that Dr. Madan has mentioned, wellness, illness to wellness and well-being? And that's all connected from mental health, which everyone is, concerned nowadays as we moving forward into the lot of digitalization, and a lot of industrialization of healthcare as well. In that way, a lot of data has been, gathered around, and so we need to think about how innovative we can be as an organization as well as individuals. What are the challenges being faced, and how we can take it forward. And so today with me, as Alicia introduced, we have three eminent panelists, Priyanka, Shivi, and Dr. Meher. And time is very short and topic is too wide. I think this is a topic we can talk the whole day, but we have limitations of time. So we have just 30 minutes, all inclusive, including what we already spent on till now. So maybe we can have a couple of minutes of conversation and open ideas of your own organizations and how you are driving this agenda. So I would just like to start up with Priyanka. Priyanka actually founded is very interesting organ, Core and Pure, a very interesting name, Core and Pure. And I was given to understand is into the business of manufacturing products from all natural products, right? So how these products can be helpful for the mental well-being, and how the digitization can actually be connected with the whole world of mental health. So I'll just leave it to Priyanka to open up this thing. Over to you, Priyanka. Thank you.
Yeah. Thanks a lot. Thanks a lot for having me here. And good evening, everybody. This is Priyanka Sachdeva, and I'm founder of Core and Pure. As Mr. Rana said, so Core and Pure is an essential oils and based product company, and we manufacture products for concern specific based on essential oil. Because first of all, I would like to say what exactly essential oils are. So the smell you get from any plant is because of the essential oil component present in that. And they are volatile in nature and are nanoparticles. So whether you inhale it, consume it, or use it topically, it enters your blood vessel. And whatever will go to the blood vessel would work on your hormone. So this is how it works on the hormone. And 95% of the problem what we have is all because of the hormonal imbalances. So we manufacture product based on essential oil for concern specific, working on the root cause of any ailment like sleep disorder, anxiety, depression, arthritic pain, and many more. So when you talk about how this helps, I told you that essential oil works on the root cause of anything, and this is how we are manufacturing product for this thing. You want me to take it up more in the digitization, or here just the introduction, and then accordingly others can introduce and we can take it up?
Maybe it's good that if you can connect with what you're doing and how it is connected to the mental health.
Right. So what happens is, specifically when you talk about stress or the mental health, this is very important. And if you are stressed, it will lead down to major problems. And approximately, if you see 29 major diseases, definitely anxiety, depression would lead to this. But apart from that, like blood pressure, you talk about diabetes, heart attack, arthritis, cancer, all somewhere if you are under stress, it would impact your immunity, it would impact your hormonal imbalances, and then it would lead to this. So what, as I said, that essential oil is something which just in inhalation, if you are taking this, it would balance your hormones. For example, I'll just give you very common example in household. Traditionally, you see, every one of us were said, whatever the religion you follow, we were said to do, havan or, fumigate, loban at home. And it was said that the negativity will go away. There is nothing outside, right? It's all inside. We are not, changing the arrangement of the house and all. But through inhalation, that essential oil component, when it is fumigated, goes through your olfactory inside your blood vessel and works on the hormone and keeps your, like, cortisol is a very important hormone which impacts you. It is important in terms of the development, as well as when it is on the higher side, it impacts your mental well-being. For example, okay. So, for example, if you are, if we talk about, when the kid is in mom's womb, at that time, if mother is stressed, the level of cortisol is so high that, if it is entering the uterus, then the kid is also swallowing it. And if the kid is swallowing in later stages, you will see that the genes are impacted and the kid can be in very panicking state, like, very small things, he or she can start panicking. So this is how these essential oils in inhalation you can take, and it will keep you completely calm, relaxed. And once you are not stressed, many things would be taken care of.
Thanks.
So that's how
Thanks,
these products are
Priyanka.
impacting and
Thanks for
helping.
sharing your thoughts on usefulness of essential oils. And if time permit, I'll come back to you over second round, connecting with the digital world, how it can be, right? So now moving on to Shivi Sabarwal, and
Right.
really another interesting panelist. Shivi is co-founder and director of WellM, and which is actually, I just did a little bit of research, not much, but is on how lifestyle can change the things for human beings. Okay, so I just would like to hear from Shivi what she think about how your organization can contribute, or the processes you are thinking of can increase the mental health and mental well-being of individuals. Thank you.
Sure. Thank you so much. Good afternoon, everyone. I'm Shivi Sabarwal, and I'm the co-founder of Wellum. It's a mental health support platform. And thank you so much, firstly, for giving me this opportunity and honor of presenting my views and also my learnings about the digital health space of mental health. If I talk about Wellum, Wellum is a platform that we have been passionately building to provide an ecosystem of care for people who not just want to provide or to basically take help, but essentially they want to understand their emotional state of being. And then thereon, there's a beautiful journey that we have crafted for them in order to give them guidance from caregivers to self-help tools to guides, etc. Personally, I feel it's been a rewarding 3-year journey for me, being in the space of spreading awareness about mental health in corporates and in institutes. That's the area that we target. But honestly, I feel there is a long way to go before we start normalizing and destigmatizing these conversations in India and prioritize not just mental health, but also self-care for individuals. So talking about my learnings, Wellum, when we started, was actually started as a holistic well-being platform. And it was a web-based platform. But soon we realized that if you really want to work on the happiness quotient of people, then the focal point needs to be mental health. As that's the window to actually your well-being, because it impacts not just the emotional, but your physical, but your day-to-day operations as well. And also we wanted to basically support people through a 24/7 platform, which provides the right guidance, right tools, and right caregivers to people. So hence we created a very robust platform, which is in the shape of the Wellum app. I would call it like a secret confidant for people who are looking at a holistic mental health solution. And since we've gone on the app, I think this has really been a game changer for us. So the app basically suddenly made us accessible to people, not just in corporates, not just in institute, but also in BC towns who may not have access, to proper care, and also at a very nominal fee. And I think the app also made it possible to break the barriers of time, of region, and provide support to people at any time when they need it. So I'm quite, I would say, proud at this point of the platform that we've created. We provide a 24/7 support. We offer one-on-one therapy. We've created actually a standardized tool, which is called the Joy Care Assessment. Joy Care Assessment actually helps you understand your emotional well-being. And from there on, take the right actions on daily basis with the nudges and the support that we provide. We've also created an assessment which is called the self-care assessment, essentially, which helps people in understanding their lifestyle in accordance to nature. Because there are a lot of times the answers are hidden in how are you leading your life? Are you exposing yourself enough to sun? Are you drinking enough water? Are you exercising enough? What are the right people that you're surrounding yourself with? So there is a proper tool and guidance which is provided by the app. And also what we've done is on the app, we've also provided community support. A lot of times with mental health, what happens is people are not able to express themselves because they have the fear of being judged. So we have a community aspect on the app where people can actually come and talk about their feelings anonymously. And they'll see that they find a lot of support from people in the community. Plus, of course, we have therapists who look at these messages and conversations and support them in a positive manner. Yes, I think mental health community plays a very big role, because most of the times you want to be heard and feel supported. I think with corporates and institute, we also started, this beautiful thing called the listening circle, which I would say is not really therapy, but still it helps you to release a lot of emotions, and then you start connecting to people. So this is where we are at this point in time, and I hope to take it wide around in the country. Maybe I can talk about the challenges, I think, in the second round of what we are facing right now.
Thanks, Shivi. Thank you very much for opening your conversation about lifestyle and how it connected through app. Now we move to the third panelist, very eminent person, Dr. Sushil Kumar Meher. He is the head of health IT, AIMS New Delhi, and over 3 decades of experience in health informatics and all, and what others organizations, platforms, apps are using. He is the person actually driving many of those items and building blocks of those digital world. So I would just request Dr. Sushil to please open up with your conversation, what you feel that how this digital world, I can use the word digital in your case, digital world is actually helping in mental health. As we know, that our government of India's, telehealth platform actually totally changed the platform of healthcare to reach to the accessibility and all. So how you think that the digitalization and digitization can help really building blocks in making the health for individuals a better option? Over to you, Dr. Sujit. Thank you. You are muted, sir.
In the health IT, I was working last 35 years. And in AIMS, I am working last 32 years. I have seen from the beginning of the digitization of healthcare to the today can say AI-based healthcare. In this journey, I have felt that how the patient can be facilitated through technology. And the only technology is that information technology. Okay. Everybody, they always be afraid to reach to a hospital to get a treatment because they afraid that they might have some critical disease they have. That's why they are coming to the AIMS. That's why we have to facilitate them in such a way that everything should run smoothly to that. If someone is coming to the AIMS, they can empower themselves to do the registration themselves. Just last panelist, they have talked about the ABHA ID. Okay. Right now, I'm talking about the integration of ABHA ID in AIMS registration process. You take an appointment online, reach to the hospital on time, go to the OPD hall, there is lot of QR code is available. You scan the QR code, then automatically from the QR code, it will ask what is the appointment number. If the appointment number is there, you can fill it. All the details will come up. Then it will ask that, do you have the Aadhaar ID? If it is not, then it will create the Aadhaar ID to integrate with the Aadhaar ID. Authentication from the Aadhaar, your Aadhaar ID will be created, and simultaneously AIMS ID will be created. So that what it happens, whole process, it takes the people not required to wait in the hall to come there turn to get the registration. Because in the morning, we are getting 14,000 patients in the hall, 14,000 patients. It means that about 30 to 35,000 people are in the hall, because each patient carry one a person with him. That is, we say these peoples that, see, this is the Indian system. Somebody carrying one or somebody carrying two. So in this crowd, to manage this one, this is the one best process which we have done it, that this seamless registration process, those who have the smartphone, no internet connection is required, Wi-Fi which will be given to them, they do it and they can reach to the doctor immediately. This is the one process we have done it. Now up to the mental health. Okay, one example I'm giving to you. If you go 10 years back, every year 2 or 3 students, they do suicide in AIMS. And right now it is totally zero. Why it is zero? We have taken a step on it. When the students come to the AIMS, we do the counseling, and we have found those who are coming for the post-graduation level, around 90% are on depression. Because all the cream doctors, they are coming to the post-graduation course to AIMS, and they are on depression. And what we have done it, we have started one apps too. The first, before admission, the counseling has to be done, and treatment plan has been done, and everybody has to register on that apps. After that, when the exam will come, then one questionnaire will send to them. Then we'll know that what is their mental state. And beside, if somebody is getting treatment and he is not taking proper treatment, he is not reaching to the doctors on time, we are sending the message to them. You are sending the message to their family, or we are reaching to the student directly. So in this way, we have done our homework, that we have saved 2 or 3 people, the cream and one of the best doctors' life, those who are suffering in mental health. This is one of the things what we have done it. Another part we have done it during the Corona. Technology has given such a high hand to us, that how to get the person he is on depression. As per the data, every 1 lakh, there is 2,500 people are on depression, which is not been detected in India. So what it happens, we do not, and during the COVID, it has gone 3 times. So what we have done it, we have AI-based application has been developed, and we have taken the data, his face value, his voice, and some clinical questions, if he's giving it. And we are predicting that this person is on depression or not. If he's in the depression, what is the grade of depression, we have knowing it. If the grade is very high, we ask them to reach to the hospital immediately to get the treatments. So these are the technological leverage what we have got it today's stage. Over to you, sir.
Thank you, Dr. Suresh. Thank you so much for sharing your ideas, views, and experience. And it reminds me a movie which I watched 2 weeks ago. I don't remember the name, obviously now, but that's in that movie. There are friends, and one of the friend is actually is an entrepreneur, the lady, and she developed an app, like you just mentioned. And that app was actually helping getting data, and they get the alert. If somebody's under depression and is tending to suicide, then they will get the alert and they will reach and then prevent its suicide. So it's just coinciding with what you mentioned. Maybe they have taken your ideas and built that on that part. So thank you so much, which actually is very practical. And this is what the digital mental health actually can be connected very well, that how we can use technology, digitalization, information technology in integrating into a system or app or whatever platform you say, which captures data and give you the information based on which we can make a choice and make a decision that what can be done. Reach out to the person, safeguard, and whatever thing. So it's like collecting data, making it into information, and make use of that information in preventing such things which might create a lot of problems. So now go back to Priyanka. Core and Pure is using the essential oils for the mental well-being. But coming to that, how actually you think you can make use of digital world in making it more effective and efficient? And that
So,
can be something for you as well. Thank you.
right. So, am I audible?
Very much.
Yeah.
Thank you.
Yeah, great. So, a very common thing here as we are sitting, but from this event itself, let me correlate this. So, this event was supposed to be offline, right? And we could not do it, and we are doing it online. People who are not here, once it would be posted, people can see those who are not present at this particular moment as well. In the same way, for example, Core and Pure, at Core and Pure, what we do is every Friday we do live with some expert, like, it can be with the psychiatrist or the gynecologist or the orthopedician. And then those people who are not able to come in front, because there is a big taboo about mental well-being, right? If I am everybody, let's say, for example, WHO says that just a minute. So WHO says that about by 2035, approximately every household would have people suffering from mental well-being, right? Mental health issues, and you can understand the situation. And we are not able to come out and talk about it. If you have been able to correlate it digitally, if the videos are there or the knowledge about it is there, those who are feeling helpless, going and reaching out to doctors or coming in person, they can see this content can be uploaded online, and it can help people to take care of themselves. This is one thing I feel. Another, apart from that, there are telemarketing, or another thing, as Dr. Sunil was saying, that we have with the language, with because there are in different field of medical sciences. For example, there is something where you can cough, and from phone you can find out that whether the person has tuberculosis or not. In the same way, with the language, with the heart rate, with the fingerprints, and everything, you can find out whether the person is under mental stress or not. And by doing that, apps like Calm and all are helping people to understand at what stage they are, and they can take care of themselves, or other can also help them, but like family members can help them to understand and come out of that particular situation. Because see, mental health in today's lifestyle, as Shivi was talking, that it is lifestyle thing, it is 100% lifestyle thing. Prior, what we used to do, we used to meet people, तो वहां पे भी कुछ hormones release हो रहे थे. Those हम बोलते हैं dopamine, oxytocin, serotonin and endorphin are known as happiness hormone, right? And these are secreted by the natural thing what we do, meeting people, praying or exercising or meditation, लोगों को दान देना, so something like that we are doing. And हर चीज से एक hormone release होती है. People are not aware about it. आप digitalization से चीजों को upload कर सकते हो, वहां पे बता सकते हो. People like Shivi, people like me, people and many others, who are working in this particular field. Now, AIMS, as sir is saying, that is working a lot, and government is working a lot on this. अभी तो इस बार के budget में we have budget allocation as well for these things. So you can understand the way it can be developed, and it can easily reach out to the B, C, D category of cities as well. So this is how I believe, digitization can help in taking care of the mental health.
I think we lost him.
Are you there?
I must
Uh,
compliment you, Priyanka, on the essential oils that you're doing. I personally use essential oils, for myself and even for my kids.
Oh,
Yes.
great, great. So that is what the kind of awareness I am trying to create, and definitely hospitals now, mainstream doctors are prescribing these products. So I'm
Yes.
glad about it.
Yes.
I'm glad that people are taking and working a lot on this. So, sir, by the way, I had got the chance to meet Dr. Guleria in one of the holistic well-being program what he was addressing, and I told him, sir, you are talking about holistic well-being, but mainstream doctors are not into natural things. So he said, no, you will see them coming up. And this is what I can see now. People are very much open to these kind of things.
Yes.
Great, this is amazing. Dr. Mehra, would you like to say something about the topic on digital health in your closing remarks?
Yeah, I see. Just I have told you, technology not an issue. Issue is the application of technology in a healthcare is challenging to implement it, and people the acceptance levels also. Earlier, what happens before COVID, nobody is interested for the virtual consultations. Right now, people are ready for the virtual consultation. This culture has been changed right now. Right now, the technology has come up. The IoT device has come up because internet strength is so high right now that you can put the instrument in your body and remotely it can be monitored. So this is the things it is right now. It is reality it has come up, and real data is fetching to the doctors directly. Even though some of the instruments are there, they can alert you that this things maybe happens. So next features in the mobile, it will come, all the features, it will be the healthcare based, because the features in the mobile, it is already been saturated. Either the speed will go up, or it is after now it is 5G, now 6G will come. That change you'll get it from the technology level, but application levels only healthcare is there. So many things it will be integrated with the healthcare, and that is the real time information you will get it from the mobiles. That's why we tell it is mHealth. mHealth has playing a major role in our life right now. When we are walking, you want to know what is our pulse rate, what is our BPs, everything it is already been in our wearable devices, which is are wearing it. So simultaneously, many things it has come up. Earlier, what I have told you, to recognize the face, recognize your eye, recognize your voice, then you can predict that you are under depression or not. That is the things it has come up right now, because AI is playing a major role for us. Recently, you might have seen in the newspaper, we have launched a new product that is early detection of breast cancer and ovarian cancer. And it is in the public domain. Anybody who will register it, they can use this application and they can predict that the person has, or that lady has, the breast cancer or ovarian cancer or not. So this is the things right now slowly coming up. Government is putting a lot of efforts to get new things to come in. Recently, what we have launched one more things. We can predict the newborn baby which moving from the delivery room to neonatal ward. That we can predict that this baby will get what kind of infection. So if you know early, then we can detect, we can take the major step on this, that this kind of infection, how will not be done, then you can do it. Simultaneously, mental health also. Whether the person is not going in 1 day or 2 days or a month to mental health, mental disorder. If we can predict early, then it will much better. Say he is going for this bipolar disorder or something, because many people, they are suffering bipolar disorder. So we can do some counseling. So you can take the step before coming something to us. So these are the technology you have to leverage it. Many people, they must be knowing it. ChatGTP. So ChatGTP now also playing a major role right now. But in healthcare, my request to the audience to that, don't dependent totally to the ChatGTP. ChatGTP can be used as a screening. If
Yes.
something is coming, then you go to a doctor and take a consultation. This is my suggestion to. Thank you.
Absolutely. Thank you, sir. I think my apology for disconnection. Digitization and this failure of technology. But wonderful to have you all three. I think there are many ways. There can be many ways of reaching the same goal. Somebody can reach through essential oils. How you can create things better. And somebody can use lifestyle changes and reading the mind, reading the behavior, and then obviously the technology. What Dr. Sushil mentioned, the use of technology in extracting the data and in converting them to the information, which is the valuable information giving us to act on. So I think that's the basic essence, whether it's a mental health or is a physical health or any type of health. But I think how we can really leverage on the appropriate technology. It's not everybody can't use AI here. We have to really make use of our own mind, basically what mental health we have, into ensuring that we use the right technology at the right time, at the right place, for the right perspective. I think those are the things which we have to take as an essence. But again, I would say we can reach to the same door by different channels. How you adopt, left to the choice to the people who want to adopt those choices and select those choices out of those available to them. So I think thank you all three of you for your wonderful three different perspectives. I think no webinar can have three distinct, and fourth one is me coming from an accreditation organization who develops standards for healthcare, starting from a clinic to hospital, telehealth, and everything, even mental health. Also, I think this is a very strange and combination of expertise coming from all three of you. Thanks, Alicia. Thanks, the organizer, for having us here for this very interesting webinar. I'm sure whosoever is available to attend, they will get some enrichment in their mental health, and they will think positively how they can change the life of individuals in a positive manner. Thank you very much, Alicia, and over back to you. Thank you.
Thank
Thank
you.
you, everyone.
Thank you. Thank you, everyone.
Thank you. Pleasure to be here and meet all of you.
Like
Yeah,
talking
same
about
here.
me also coming from an era wherein the mental health is very important. I also think that it is very important to have a brief understanding what you are going through, and having these applications in the market is really helpful for us, and of course for a new generation also, with the digital watch, of course. So thank you everyone for joining. Now we are just going to our closing ceremony. I would like to say a big thanks to our organizing team, the GCIT events team, our sponsor, Away Health, and Ministry of Micro, Small and Medium Enterprise, our esteemed speakers and their organizations for their support, our attendees, which is more than 1100 plus in 34 countries we were live. So kudos to that. And our partners, Amand, ATechnos, PhD Chamber of Commerce and Industry, Away Health, Away Ventures, Wellem, Idea RX, Lowy Global, Go Games, Olive Life, Grid Council, and Share India. This has been a wonderful association working with you all. Thank you everyone for joining. We look forward to hosting you again in our next edition of WDWF. Thank you.